There are likely many roads to a healthy, sustainable food system. Let's take a step back and appreciate the complexity of the undertaking. Climate change will clearly affect yields from food production, and no surprise to anyone here, food production contributes significantly to climate change. The FAO suggests that livestock production accounts for roughly 15% of greenhouse gas emissions. That's more than the transport sector. And livestock production also accounts for the vast majority of emissions from agriculture and land use changes, such as deforestation. Now, a major driver of this relationship is, of course, growing meat consumption. And behind this trend, of course, is the intensification of food animal production, which comes with significant externalities. For those of us working on these issues, we can point to any of a number of potential policy triggers for change. Now, consider how these factors come together in a country like China. China is already the world's largest producer and consumer of pork, the world's second largest poultry producer, and the world's largest importer of soybeans for animal feed. And while per capita meat consumption in the US is still twice as high as in China, meat consumption will rise in China at a much faster pace than in the United States. To meet this growing demand for meat, the country has become increasingly reliant on grain imports, much of it for animal feed. Chinese-owned concerns have moved to acquire global agribusiness firms like Smithfield Foods and now Syngenta. And as suggested on these bar graphs, the country is moving towards an industrial model of food production. And in step with these changes, China will account for 30% of the global antimicrobial consumption in food animal production by 2030. Now, recently, though, the Ministry of Health of China has announced dietary guidelines that recommend people to cut their red meat intake by half. This recommendation alone, if implemented in China, could go a long way to lowering CO2 emissions in the country. What, though, might be the game changer to move China towards a more sustainable path of food production? The normative sway of Ministry of Health guidelines, dietary guidelines over providers and patients, concerns over food safety, or national security concerns over increasing dependence on grain imports to feed livestock? What might we learn about another game-changing moment in global health? Well, in the late 1990s, scenes of what you see like here were not uncommon in the streets of cities like South Africa and elsewhere in the developing world. An estimated 25 million people afflicted with AIDS faced a death sentence for a disease that we knew could be treatable if we could just produce, move, and deliver the right 3-drug treatment to them. With such treatment, we could commute the sentence to a chronic disease. But at $10,000 to $15,000 per patient per year, this was a non-starter for global development aid agencies. This is what I call the price of hope. Without treatment, who would seek voluntary counseling and testing if all they were promised were a lifetime of stigma and no treatment? At that time, as a program officer at the Rockefeller Foundation, I wondered, by lowering the price of hope, could we catalyze change? My first grantee, the Consumer Project on Technology, now known as Knowledge Ecology International, would go on to negotiate a deal with Cipla, an Indian drug company, to bring the first generic triple drug treatment regimen to market at a price of $350 per year, or less than $1 a day. At less than $1 a day, the global development aid agencies could no longer turn a blind eye to the problem. Only when the price of hope came down did it become possible to consider the launch of a global fund. The struggle for more affordable HIV/AIDS drugs had another important consequence. Policymakers began to take a deeper look at why publicly funded HIV/AIDS drugs led to such high prices. We began to deconstruct the value chain. The language of product development partnerships, of TRIPS and intellectual property rights, of push and pull financing became part of the public health vernacular. What was unique about AIDS was that there was a vibrant civil society movement, both north and south, and the confluence of triple treatment therapy for treating AIDS, and the need to bring greater policy coherence between public health priorities and a global trade regime advancing a floor intellectual property rights. Lowering the price of hope was a game changer that set off a cascade of policy actions. Now, such a policy trigger for the food system might be antimicrobial resistance. With crisis, there may be opportunity. With the global momentum going into the high-level meeting on antimicrobial resistance this September at the time of the UN General Assembly, the emergence of resistance to colistin may be just this kind of policy trigger. Colistin is an antibiotic used as one of the last-line defenses against drug-resistant infections in human medicine. This past November, investigators in China discovered MCR1, the first ever documented finding of plasmid-mediated resistance to colistin, where resistance spreads from one bacterial species to another, a finding that sent shockwaves through the global medical community. Because of its known toxicity, colistin is seldom used in humans, but serves as a drug of last resort. By contrast, it is widely used in treating food animals. Could colistin serve as a wake-up call to policymakers to take a deeper look at the system of industrial food animal production? Between now and 2030, 2/3 of the projected increase in antibiotics in food animals will be because we are consuming more meat, and 1/3 because of the shift to this more intensive form of production. Reducing meat consumption will help. Now, even if antimicrobial resistance proves to be a pivotal policy trigger, where in the food value chain are the most promising points of intervention? On the demand side, we've seen important progress from consumer groups calling on food retail chains from McDonald's to Subway to source meats raised without the routine use of antibiotics. On the supply side, consider an intervention like a tax on antibiotic use in food animals. An economist might suggest that such a tax might be sized to offset the negative externality or the true cost posed by drug resistance, in other words, a Pigouvian tax. In a virtuous cycle, such a tax applied to sales of antibiotics for food animal use could eliminate low-value usage. A tax applied just right would make it unprofitable to use antibiotics for growth promotion, but still justifiable to treat diseased animals. From the same intervention, though, a vicious cycle might ensue. A tax might have disparate impact upon a smallholder farmer compared to a large-scale industrial food animal production operation. The result? The tax might be too high for a smallholder farmer to treat her diseased animals, but too low to deter the use of antibiotics for growth promotion in a large-scale factory farm. In both virtuous and vicious cycles, each iteration of the cycle reinforces the last. And yet, we often do not fully know in which direction the intervention will lead us, virtuous or vicious cycle. So the solution might seem straightforward, just curb, phase out, or ban the use of antimicrobials critically important for human medicine, like colistin, from use in food animals. However, this may prove challenging, unless one considerably widens the circle of what might be covered. Co-resistance from other antimicrobials, not just the critically important antibiotics useful in human medicine, might induce resistance to these very important drugs. And also of concern, absent what we might even typically consider as antibiotics, new studies suggest that biocides, like glyphosate, also known as the herbicide Roundup, can cause resistance in bacteria, like E. coli and Salmonella, potential pathogens in the human gut. The use of antibiotics in food animals could also have unintended consequences. Our recent study suggests antibiotics given to cattle can alter not only the microbes found in the gut of livestock, but also the dung of antibiotic-treated cows, such that they produce nearly twice as much methane, a potent greenhouse gas, compared to non-treated cows. In finding the simplicity on the other side of complexity, we also may need to curb the non-therapeutic use of all antibiotics in food animals. Giving antibiotics for growth promotion or prophylaxis to animals when they have no disease is no way to spend a life-saving resource. In testing these different approaches, how might we keep our eyes on the prize? To that end, we might design and build what might be called accountability technologies. Imagine if we could develop a diagnostic simple enough to be placed in the hands of ordinary citizens that could give us a readout on whether the runoff from a factory farm carried drug-resistant pathogens, or whether the grocery shelves have retail meats contaminated by such superbugs. We could pinpoint drug-resistant pathogens along the food supply chain. Imagine that such data might be crowdsourced, shared in a cloud as part of a citizen science project, where the aggregated data tells us more. And finally, how might such data help ensure the transparency that leads to accountability? Such crowdsourced data could make latent policy signals visible, identifying hotspots of drug-resistant pathogens, from factory farms to food shipments being traded across borders. Such data could feed into a scorecard, a map, or even a certification scheme that persuades policymakers or the public to take action. By accountability technologies, I mean tools that employ the 3 C's: collect, comprehend, and compel. Whether you're tackling food waste, joining Jamie's food revolution, or applying the 3 C's to the Eat Forum's 5 C's. By taking measure against the hoped-for outcomes, such accountability technologies might help us steer towards more healthy, more sustainable food systems, no matter what roads we take getting there. Perhaps part of the solution in finding the compass as well as the North Star. Thank you very much.